Hi, this is Eric Moldenhauer. How are you? Just wanted to touch base this week and let you know that I am dedicating this week to women. This will cover anything from medical issues to menopause to diabetes, you mention it. Basically, I'm going to take this week out just to talk about those issues as they are very important and sometimes not talked about. So, as part of my continuing education and knowledge that I want to pass along to everybody, this will be information that should be very helpful. So, without further ado, today I want to touch base on women, heart disease, and stroke. Now, you may or may not know this, but heart disease and stroke are the number one and number three killers amongst women. This is more than all forms of cancer put together and any other kind of medical condition. So, it's a very important issue. And although you may not realize it, it is one of the two biggest killers amongst women. So, what are some things that you can do to help prevent them? Well, first, I want to mention just a few things that are not controllable. Your gender, of course, your age, and also family history. Those are things that are just not controllable, and there's nothing that we can do to change that. So, but there are things that we can focus on that can be beneficial and can help either prevent or turn around these issues. So, the first one is high blood pressure. Now, a lot of people think that high blood pressure is hereditary, and to a certain extent, it is a little bit. However, it can be controlled with a proper diet, exercise, and medication. Therefore, I classify that as something that you can control. So, if you do have blood pressure issues or you think you may have blood pressure issues, I suggest going to your doctor to have it checked out. Unfortunately, a lot of times there's not symptoms, so myself included, I have high blood pressure and didn't really know until I went to the doctor. So if it's something that you haven't had checked before, please make sure that you do it. A second thing, kind of correlating to that, is cholesterol. Now, cholesterol, again, can be partially hereditary, although if you are eating a lot of high fat foods or foods with a lot of trans fat, a lot of sugar, whatever the case might be, this can also contribute to your cholesterol levels. So, again, you might want to talk to your doctor and see if you do have high cholesterol. There's medications that you can take, or again, there's other things you can do, such as exercising and cutting back on those foods. Another thing is diabetes. Now, diabetes, again, sometimes can be, hereditary to a certain extent. And, a lot of these things do kind of get passed down from our family, but they are controllable. So, again, diabetes, I won't go into too much because I am not an expert in it, but I'll just say that, there are certain levels that we want to try and stay below. So if you have experienced any symptoms or if you've had it in your family or your doctor has mentioned it to you before by taking blood tests and said that your sugar levels appear to be too high, then again, please talk to him and see what else you can do to help control this. And then just a few other things to mention are, which I kind of touch base on, are being overweight, your activity level, and your stress levels. Now, as far as being overweight and obese, pretty much if you are more than 20 pounds over your suggested weight, then you are considered overweight. Again, this is a very easy fix, not easy in the sense that it does take some work, but you can start changing your diet, your eating habits, and working out to help control that. Stress levels, I know we all have stress, whether it be your job, your family, bills, whatever the case is. I mean, stress is pretty much unavoidable, but there are ways that you can control it. Exercise actually is a great way to do that. So, incorporating that exercise to help reduce those stress levels can also help decrease your risk of heart disease and stroke. So, just a quick recap is things that we can't control are your age, your gender, and certain hereditary things within your family. But things that we can control are your weight, your physical activity, your stress, and your diet. So, again, if you have any of those things that are controllable, certainly, if you can't control it on your own, certainly talk to a doctor or some type of professional to see if they can help you, and certainly talk to your doctor for anything related to diabetes, cholesterol, or high blood pressure. So, just wanted to touch base, let everybody know that those are some symptoms to look for, and I will be back tomorrow to provide some additional information. And ladies, stay healthy. Thank you.